Okay, hello, welcome to my YouTube video. This is addiction, let it go. So I did a mini research project over addiction. So we'll go over the causes of addiction, the effects that it has, and some things that need to change about the way that we look at addiction and how we treat it. So, firstly, I just want to begin by kind of introducing the topic to you. I think we all kind of have a basic idea of what addiction is, but I want to let you know how I am viewing it and the way that I I'm going to be presenting it to you. So, as somebody who has a close family member, I guess we could put it that way, a close family member who suffers from addiction, this topic was kind of important and personal to me, so that's why I chose it. But yeah, so that's kind of my background on this. So addiction is defined by the American Society of Addiction Medicine is, quote, a treatable chronic medical disease involving complex interactions among brain circuits, genetics, the environment, and an individual's life experiences. So, this about basically this definition is from the national society that deals with that specializes in this topic, addiction. This is their definition, and they say that it's a chronic medical disease. Chronic means lasting over time, which means, it's not just like the flu, you get it, you're sick for 1 or 2 days and then it goes away. This is chronic. It means that it can stay with you for months, years, sometimes even a lifetime. But anyway, so the causes of addiction are off the charts and range from a history of addiction in genetics to the easier access of substances and alcohol. And when I say this, I mean there are many causes of addiction from your genetics. If you have if alcohol, or not alcoholism, well, that's a form of addiction. If you have addicts in your family, you are more than likely to be an addict. Now that's not to say that you will be, but it's in your genetics that you could suffer from addiction. And so just a history of addiction in your family, in your genetics, or nowadays I'm seeing that it's more how do I put this, substances that are that you can get addicted to are more accessible. We have more access to them. So let me just think of something like alcohol. Okay, so the legal drinking age is 21. Many, and I say this from experience, many kids nowadays have access to alcohol even though they're not 21. Whether it's friends that are 21 who get it for them, sometimes family members who keep it in the house, they're getting it from there, or just people not IDing them. I mean, that's a case. Like, for instance, in the small town of Aspermont, sometimes you can get away with it because they don't always check IDs. These are all causes of addiction. So society has turned a blind eye to this disease. We don't really pay attention to it anymore. When you see an addict, walking down the street, you're like, oh, he's on heroin, whatever. You don't really care about it because it's really common. And I think that's why we've stopped paying attention to addiction. So people go about their lives without acting upon this outbreak until it affects someone that they know or they love. For instance, I was one of those people. I did not, seen them on the side of the road and was like, they chose their path. What am I supposed to do about it? And then, like I said, my family member became an addict and still is one. And to this day, I paid closer attention to it, like, choosing this as my topic for this research project, because it's affected me personally. And we don't really care about that until that happens, until it becomes personal. But still, nothing's done about it. People have this idea that it is what it is and that nothing can change it, and that logic is wrong. And that's what I'm here to talk about. So in a book called The Anatomy of Addiction by Akikar Muhammad, MD, I apologize if I said that name wrong, but he explains that addiction is in fact treatable and preventable. And we like to say that, my grandpa was an alcoholic, there's no stopping it, like I'm going to be an alcoholic one day. That's not an acceptable way to think. So you can prevent it. Even if it's genetic, you can prevent it and you can treat it. Aside from AA meetings, rehab, and detoxing, there are more effective ways to treat addiction. And Muhammad, being a medicine specialist, psychiatrist, he was an assistant clinical professor of psychiatry and the behavioral sciences at the University of Southern Carolina. He lists a couple of ways to treat it and to prevent it, including the use of appropriate medicines, and a comprehensive medical diagnosis and individualized care. And these work better because they don't treat all addicts as one. Like in rehab facilities and things like that, they treat their addicts who are in there like, okay, they're all addicts. Okay, that's not right. Like, it should be, okay, this one's an alcoholic. He's addicted to alcohol, so we have to treat him this way. This one's addicted to heroin. How are we going to treat that based on that? Not, they're all addicts. We're all going to give them the same treatment. We're going to give them all the same care. So rehab facilities automatically assume that all addicts have the same diagnosis and addiction. And I get that this is somewhat correct because, yes, they are all addicts, but addiction affects people differently. So it should be treated differently. And when I say treated, I don't mean like, oh, we're going to treat this person like, crap, or we're going to treat this person exceptionally well. I mean, we're going to medically treat them, to cure them in a way. So once diagnosed and treated, addicts may never fully recover. Addiction doesn't necessarily go away. Relapses are common. An article on startyourrecovery.com suggests that life after rehab is hard, and that this is what rehab and therapy should be used for, to integrate addicts back into society. Because once you once you're an addict, it's like, well, this is how I've always lived, so now that I'm not an addict, what am I supposed to do? Because I'm constantly surrounded by other addicts, and like I said, addictive substances and alcohol is easier accessible. So how do you stop them from doing it again? Basically, they need follow-up support, and rehab and therapy shouldn't be used to treat it. They should be used to provide follow-up support. So addiction is 100% a disease, and it can cause irreversible brain damage, and no matter what treatment is provided, life may never be the same again.